everything for me, nothing he can.
For many women, menopause hits like a tornado and many things go topsy-turvy between hot flashes and weight fluctuations, mood swings, and changed sleep patterns. What, somebody been in my diary? Is it any wonder that our oral health is also impacted? Joining us this evening is an expert on that topic, Anaida Deddy, the owner and founder of Dental X Smile Centers, including Toronto's first Tooth Fairy headquarters. And she is here to share some things we should all know about. Welcome back to What She Said, Anaida.
Thank you.
So what do the dips in progesterone and agesteron that accompany menopause hormonal fluctuations do to our system? Because I have all of the symptoms above.
It does. The menopause affects the whole body, of course, the mouth as well. And usually the levels of estrogen decrease quite a lot during menopause, and that's what causes the bones to be very weak and also brittle. So that's why osteoporosis is a very common thing during menopause, but it also doesn't just affect the legs and the arms, but it also affects the jaw bones. And that's why you have quite some stuff happening during menopause in the oral health. So,
Well, what can some of the symptoms be, and what should we be watching for?
there is quite some. Usually the most common one is it's called a burning mouth syndrome. And usually it's very uncomfortable, and it can be at different times. It's not just continuously. So it kind of comes and goes, and you definitely have to look for it. It's very uncomfortable because you have a burning tongue, burning cheeks, burning lips. And this usually is from different causes during menopause. One of the most common one is the nutritional deficiency, which you were actually telling me just earlier, that the nutritional deficiency affects a lot the mouth. So that's why we have to look at our diet and see what's going on, what can we improve. And usually it's a great idea to also have a dietitian, and they usually tell you what to do and what to take that is better for your overall health, not just the oral health.
Okay, so I'm on HRT, so hormone replacement
Yes.
therapy. Would that help protect me?
Of course.
Okay.
That's definitely going to help you. And it's a great thing to do during menopause. And also it's something that, usually you don't have to do it only during menopause. It's usually, like the nutritional counseling is usually good to do even in other times when you see that something is off in your health or oral health or overall health. Another thing that causes the burning mouth syndrome is also stress. And usually stress is a very common thing, not just during menopause, but I would definitely say that that's probably a lot more during menopause because you are not sleeping well, you are not eating well. There's a lot of things going on in your system, so definitely stress is a big thing. And probably if you can see the doctor and make sure that you can keep it under control with the stress, that's going to help with the mouth.
I was just going to say, I'd never heard of this before, burning mouth syndrome. Is there anything else?
You can definitely, sometimes during menopause, you also have thyroid problems, and that's also going to cause this kind of syndrome. So definitely you have to see the doctor and make sure that there is nothing else going through that period of time. So it's a very common thing during that time.
How should you be looking after your oral health differently during menopause or preceding menopause than you would normally?
You shouldn't. You should do exactly the same thing what you do before. But probably I would say that maybe to have a little bit more caution during menopause and see for the signs, the symptoms that you have during that time, if they are something different what you haven't seen probably previously to that. So if you see that you have a lot of dry mouth, and maybe if you are having difficulty chewing or swallowing, or even if you are talking and you see that your mouth is getting dry just after a little bit of talking, that's definitely a sign that you have to see a dental professional to make sure that you can do something to prevent or to make that better.
My gums seemed more sensitive than they've ever been when I hit that time, the change.
Yeah, definitely. And that's a very common thing as well, the sensitive gums and the sensitive teeth. Usually you see that your gums are bleeding a little bit more, they are a little bit dry, they are shiny. So what us as a dental professional, we usually say you have to watch a little bit also what you are using in terms of toothpaste and mouth rinse. Nothing against mouth rinses, but I'm not a big fan of mouth rinses. I usually like more like the grandma's recipe, a little bit of warm salt water and just rinse a little bit, and that's usually great. It helps you. It's very easy. It's cheap. It's very you can do it at any time. With the mouth rinses, because they contain a lot of chemicals, and especially the ones that have alcohol, they dry your mouth even more, usually, never mind when you are going through menopause. Also, the toothpaste contains some chemicals, and that's a very normal thing. So probably I would suggest maybe at that period of time, if you're seeing a lot of changes in your mouth, probably just use maybe some natural toothpastes. And usually the ones that contain echinacea or some other ones, usually if you go to the health food store, they will definitely have quite some different options for everybody.
I also use those little spiky picks that go between your teeth for the gums. They seem to help almost toughen them up a little bit.
Of course. We call them soft picks.
Soft picks, that's it. Well done.
Yes. So usually they are great. They are, I've heard that they are as good as flossing. I would not compare them to flossing, but they are very good and they kind of stimulate the gum. So definitely they do help quite a lot.
So when should we start fortifying our hormonal levels to protect against some of these outcomes? Should it be when we're diagnosed as being perimenopausal, so just going into menopause, or should we wait for symptoms?
Usually it's a great idea if you do that a little bit before. Menopause is just, it's just aging process, like everything else that we will see as we age. So definitely if you know that you are going through that stage and you are getting close to that stage, your body will feel it in the beginning. So probably that's a great idea if you go to the dental professional, tell them what you are going through, tell them that, you are getting close to the menopause, so they will definitely help you and tell you what you need to do even prior to getting to that period.
So if I were to come to you, would you suggest at that point, if I had no symptoms, to go to a dietitian?
Definitely. Sometimes you see different things, like even when you have the patient, especially if you have seen the patient for quite some time, you do know what's going on with the patient. So if you see that they maybe are getting a little bit overweight at that time, or if it's something that is going on in their mouth, you do feel it, you do know what's going on with the patient. So at that time, you will know if something is different. So you will tell them at that time if they need to do anything or not.
So what's the worst case scenario?
You can lose your teeth. And you can have, and sometimes it's very difficult at that time when you lose your teeth because it's very aggressive at that time if it's only during menopause. So it's very hard also to get dentures because the bone level will be very low, and probably would be impossible to get implants because the bone is not going to be there. It's going to be all resorbed. But also dentures, it will be a very hard time because of the dry mouth, because of everything going on. It's going to be very hard to keep it.
The holistic nutritionist that I'm working with doing this metabolic balancing diet is very big on vitamin D. I have the drops that are 1,000 IUs per drop, and it's 5,000 IUs a day she wants me to have. So that's good for my teeth too, right?
That's very good. Vitamins and minerals are very good at menopause time, also during, like other times. But because here we don't have much sun, so definitely vitamin D we are in need always, especially here in Canada. So definitely I would say that vitamin D is a great thing. And also some other supplements would be amazing, like maybe iron supplements, because during menopause, of course, we have anemia. So that's a very common thing that most of the women do have. And probably some iron or maybe even some other vitamins that do have iron in them.
What about calcium? I'd say that would be a
Calcium,
big...
of course, and also magnesium is another one that is great and definitely will help for the bone generally and also in the mouth.
So would you say that diet is more important even than care of your teeth?
It is as important as the care of the teeth. Definitely you have to have the foundation. So I think nutritional is the foundation, but definitely you have to also maintain your teeth clean.
All right, that's fabulous information. Now people will want to reach you. How can they reach you?
They can reach me on my website is www.dentalx.ca or anaidadeti.com.
Well, thank you so much for joining us this evening.
Thank you very much for having me.
This is What She Said. Stay with us.